You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. Before we get into this week's episode, I have something exciting to share. My new course, The Business of Physio 101, is officially open for registration, and early bird pricing is on until January 15th, 2026. If you are a new grad stepping into private practice, this is the course I wish existed when I started my career. We cover contracts, clinic business operations, pay structures, employee versus independent contractor models, sustainable caseload building, and everything about the business of physio that we were never taught in school. If you want to feel confident, informed, and protected as you move into your career, head to danielleboyd.ca/courses to learn more about the business of Physio 101. Now, let's dive into the episode. Hello, Andrea. Welcome back, fan favorite, to the Health of Business podcast.
And we're back. Thank you so much for having me again. This is so fun.
Oh, it's a pleasure. I mean, any time I get with Andrea is like special time. So I love it. Thank you.
Likewise.
So yeah, today we're going to talk about specializing, which is super fun. We kind of both have unique experiences with specializing. Your experience is like very much around specializing. So I'm really excited to dive into that because I know there's lots of people in our community who want to learn more about specializing, who are specialized, and I think they could take a lot of value from your experience with it. So yeah, to open up, why don't we get an overview of your experience with working in a specialty?
Yeah, thanks for having me. So I first started as a pediatric physiotherapist. I worked at Kids Physio Group for 4 years. And then I started seeing a few teenagers who had scoliosis. And so got some extra training, didn't think too much of it at the time. I was just really passionate about this area. And then started seeing more and more teenagers who had scoliosis because parents would start to talk with each other. And at the time, it turned out that I was the only physiotherapist in the Lower Mainland who did have this special certification, which is Schroth method for scoliosis. And so families previously were traveling outside of Vancouver. They were going to the US or to London or Australia to get similar treatment. And so when word got out that there was someone local, my caseload very quickly started to tip in the direction of mostly seeing scoliosis kids. And so, and again, to remind you, I was a pediatric therapist. So most of they were mostly teenagers who were diagnosed with scoliosis.
Mm-hmm.
And so in that time after meeting, 10 or 15 or 20 families and getting to spend a lot of time with them and also still trying to figure out my own skill level. As we all know as physios, taking a course is one thing, but then actually trying to integrate it into real life and figure out, what works and what doesn't work, that's a whole nother level. And so I was doing that. But in that process, I was so fortunate to really create good therapeutic relationships with these teenagers and also their parents. And they were so generous with the information that they shared in terms of what their frustrations were with the medical system, where they felt like they were falling through the cracks, what they wished they had access to. And so after a while, I started to see that there was quite a trend in how these families were showing up in terms of their emotions. So a lot of the parents were very anxious and overwhelmed. And then the teenagers they were either similarly anxious or they were apathetic about it and had no idea why their parents were freaking out about something. But then I started to think, hey, could I solve some of these problems? Of course, I'm not going to change the medical system, but if I could create something that at least addressed some of these issues or had them on my radar, and some of them were just low-hanging fruit. So for example, parents would say, sometimes we only get 5 minutes with our doctor and we don't get a chance to ask our questions. So then I was thinking, well, can we create something where my appointment structure is a little bit longer to create space for families to ask questions and to get them answered? And so then I took the leap. I opened as a solo practice. So it was just me at the time. And I was actually operating within Kids Physio Fraser Street at the time because that's where I had worked. And then over the last 10 years, fast forward, our team has grown. It has been a clear need in the community that there's value shown to have a place that is fully dedicated to now not just teenagers, also adults. We see now people of all ages from 3 months old up to 94, I think, and everything in between. And as our team has grown, the skill sets and the interest within scoliosis has also changed. And so we're so proud to now offer specialized services to people who have scoliosis, no matter how they present. And so in that time, there have been so many lessons, some easier to learn and many that were harder to learn. And we had to learn the hard way of really how having a focused or niche practice is really different than operating a generalized practice. And so what I'm really excited to do today is to dive into some of those things with you here, because I just have so many insights that I want to share and lessons and things. So I hope that we get to at least have a high level conversation about what some of those things are. And before we go any further, I really want to preface and say that when in this episode or in any of my content, if you end up, seeing some of it online, when I use the word specialty, that word can be interchanged with, again, a focus area or a niche. Because in some healthcare professions, I know for sure in physiotherapy, that term, being a specialized physiotherapist, is reserved for very specific things.
Mhm.
And so, but for the use of the English language, we're going to use that interchangeably here.
Yeah, totally. And that makes perfect sense. And yeah, like area of focus or yeah, whatever it is all interchangeable. But yeah, specialty just seems like a much easier term, all encompassing. Absolutely. So, yes. Good preface. And so, yeah, we will do an absolute like high level of this. And I really look forward to that. And at the very end of the episode, we're also going to look at your top 3 considerations for being within or operating or starting a business in a specialty area. So make sure to stay tuned all the way until the end for the business considerations within specializing or niching or area of interest. So awesome. Let's dive in.
Mhm.
The first question is, should I specialize? Should people, should physios, should healthcare practitioners specialize? Is it worthwhile doing?
That's such a great question. And it really is a personal decision. And so perhaps what I think would be more useful for this conversation is factors to consider if you
Mhm.
are making this decision for yourself. Some people think that by having a focused area that you are, I've heard the term being you're backing yourself into a corner, or you're having to cut out a lot of opportunity, or that you might miss out on treating other things, for example. So the first one of the factors to consider and that I want to be clear on is that you can really make an impact if you fully dedicate your energy to really thinking about trying to go deep with your knowledge rather than broad. And
Mm.
so, yes, that does mean that you will have to say no to some of the other conditions or things that maybe fall too far outside of your focus area, but it provides an opportunity for you to make a very deep impact, super meaningful, to the people who are within that specialty.
Mhm.
So, should you specialize? Great question. Some of the things to consider are, for example, what is the area that you are interested in? And then look, are you why are you interested and passionate about that area? So some people who they've had, for example, a personal experience with a condition. For example, like my family member had Parkinson's, and that's why I really want to focus on Parkinson's. Or on my team at the Scoli Clinic, I think I can't think off the top of my head, but I want to say at least 5 or 6 people on our team have scoliosis themselves.
Wow.
And so their desire to support this population comes from their own lived experience with that.
Mhm.
So consider, why is it? It can be a personal interest. It can also be like for me, I don't have scoliosis and nobody in my family does that at the time that I made the decision. But for me, it was more, I was really fascinated by the mechanics of it and how
Mhm.
we didn't really learn anything about it in physio school. But when I had taken that course, I just really, I took to it. And I really felt that I was so curious to learn more about how the spine changes and how does it affect the ribs and how does it affect the pelvis. So from a technical standpoint, I was really interested in that. And also, I really loved working with teenagers. I felt like they were my population that I could really hit it off with. And so that combination felt like this could be something that I would spend a lot of my time in.
Mhm.
Some people also specialize because they think that, they're treating certain patients or things like that, and then they realize, hey, there's a market opportunity here. There's no one else in the market who's doing that, which is also a good reason to specialize. It's because you see an opportunity and you want to go ahead and fill that gap. And so I think those are some of the factors to consider when you're thinking about it. A lot of people also, in the conversations that I've been having with people who are considering specializing, it's because they kind of feel a bit itchy in their clinical practice, or maybe it feels a bit flat, or maybe they feel like they're being pulled in too many directions at a general level, and they want to explore something deeper and really like fine tune their skills in an area. So again, a lot of it is personal desire, but it's really good to consider what the exact reasons are that you might be considering this.
Yeah, and then continue to pull that thread and explore it, and then ask yourself, is this an area I wanna do day in, day out? Is this an experience I want to continue to have, or do I want to mix it up? Yeah, I think that's super important things to consider.
Yeah. So, how I love to approach, I've found that now as a business owner, I actually use the SOAP charting method
Mhm.
and apply that to so many of my business problems. And so, let's break that down: subjective, objective, analysis, and plan. That's how you typically will document what you've done with a patient and what worked and what didn't work. And so, if we apply that to this situation, you may have a subjective feeling like, hey, I think I want to try something new, or I want to change my focus area. So that's really good subjective information from yourself. Then what you could do is also get subjective information from any of the patients that you already work with who are in within this specialty area. This is where you can do that, what is called market research. Talk to them. Hey, how has your experience been in the medical system as a whole? How many people did you see before you saw me? Is this really helpful, like coming to see me and us focusing on this condition the whole time? Would you come to a place if it was fully dedicated to have more people like you who are facing the same challenge? Is that appealing to you? And so I think you can really get a lot of subjective information just from that. And
Mhm.
then you can move on to objective. And what I would mean by that is I very clearly remember doing a Wikipedia search on the demographics of Vancouver and the surrounding area, specifically at the time because I was in pediatrics, looking at how many teenagers there were in the surrounding area. So actually pulling like census information, and then knowing the prevalence of scoliosis. And then I was actually doing math. It's 3% of all teenagers. There were X number of hundreds of thousands of teenagers. And so I said, okay, in theory, there are enough people who are going to be affected by this condition that could warrant me fully dedicating my time to it. And so, looking at objective information like census data, prevalence data, for example, also other market conditions like who else is doing what you're doing? Does this already exist out there? Is there someone else who's kind of ahead of you and leading the field and they're getting a lot of traction? And you think you can also support this movement
Mhm.
to serve these patients, um, and maybe looking outside of even your demographic area. Maybe there's someone in Toronto who's doing something similar, someone in the US, someone in Europe, and just start to actually look and see what is happening in the world surrounding this interest area to kind of determine where you fit in this in the timeline of like the general push of it, for example. So a few
Yeah.
factors to consider there. Oh, and then of course, when you go into analysis and plan, that's where you would put all that S and O data together and then decide, here are the factors. I do think that it would be a good idea for me to focus all my time in this area, or maybe not. And maybe I do that within my current practice, for example. And then you put together a plan for how to make that happen.
Well, and it's true, perhaps it's actually an area of interest that has such a small demographic that you couldn't sustain an entire clinic, maybe not even an entire practice individually. So, yeah, maybe it's something that you do acquire expert knowledge in, but it's not going to be sustainable in terms of an entire business plan. So, I think collecting that data, be it subjectively, objectively, is so essential to, making that decision as to whether or not to make the decision to specialize.
One of the greatest mistakes that founders or entrepreneurs have is that they feel that their idea is more important than it actually is, across all industries, right? And I think for physios, it's really, it would be really easy, especially if in the early days when I met these first 5 to 10 families, it was easy for me to take their lived experiences, such emotional experiences, and be like, oh my gosh, everyone else with scoliosis will also want this too. That would have been a wrong assumption to make.
Right.
And so it's really important to get the data, whether it's from other people or talk to other people in the profession, maybe who are already doing it, and see if they would be willing to share some of their struggles and wins and challenges with this work, because that's all really important and it should not be ignored, or else you will perhaps run into issues after you've maybe made a jump. So it's always good to try and get as much information before actually making any big commitments to this.
Totally. So, okay, someone's done all this planning or someone has done all this research, collected all the data. At what point should they then make the decision? Like, when should someone actually move forward with specializing?
Again, very personal decision. Let's keep in mind that there are different ways that somebody can specialize. It doesn't necessarily mean to open a fully dedicated specialty practice with a team who works for you and like a full brick and mortar. So, um, I've been really thinking about it, and I would say there are 5 main ways that people can express this expertise and bring it forth into the world. One of which is your first step, your expert clinician. And so, we have done extra training in a certain area, and maybe your actual practice location or setup doesn't change. You could be a contractor, an employee at another clinic, and you speak with that clinic owner and say, hey, is it okay if I really want to focus on this area? Is that cool? So you can be an expert clinician within an existing practice.
Mhm.
Another way that you could really, bring and make an impact in that specialty area would be to be a clinical teacher. So many people in our community work as TAs at UBC, for example, or they are mentors within the community. Like, for example, I remember taking a few ortho levels, and we would find individuals in the community who are willing to mentor us. And so that's a way that you can also share your expertise. Or you can also develop workshops on your own, for example, especially
Mhm.
if you've come up with something that's a little bit novel or you've combined a few different techniques. That's a
Mhm.
way that you can specialize. Of course, you can be a specialty business owner. Um, and that would, again, require making that full commitment into creating a corporation and then going down the business path, which is a whole other conversation. You could also be a researcher. So I've spoken with, there are many people in the physio community also who are involved in clinical research, whether that's through they're doing it on their own in a practice, or they've found some partnership with an academic institution,
Mhm.
or maybe even, and they've maybe been able to get some funding sources and things like that, because that's also a way to really contribute more so in the long term than the short, but a way to contribute to this whatever population or specialty that you choose. And then, which is something that's becoming way more common probably in the last 5 years,
Mhm.
is to be an online guru and really focus on getting that specialty information, putting out little nuggets on Insta and TikTok and LinkedIn, however it is that you choose. And so just keep in mind, like, of course, my experience is more the specialty business owner, but there are many ways that you can show up, and it's not so black and white. of course, you can also be any combination of those five that I mentioned. And each of those five will have different considerations that we unfortunately won't have time to really dive into today.
Mhm.
But there are really so many pros and cons and things of like how you might just shift your approach to your work if you do want to show up in one of these various ways.
I love that. And yeah, it's so much of it is about gathering that data and then making a decision based on obviously your personal choices, market availability or market fit, product market fit. Yeah, demographics. There's so many pieces to help make that decision, but ultimately, really, it is that personal choice and commitment, and then choosing which path you want to take it down. So, a lot to consider.
One more thing I think that's important to cover here is a really common question that we get is should you is it harmful to specialize right out the gate as a new grad, or should you wait until you have more experience? And again, in my experience, I've hired many of physios who are in at various points in their career, and I would say that there are certainly pros and cons or eases and challenges of either. So at a high level, new grads are typically, you're already in a learner's mindset to take on a new skill set, to really like spend the extra time outside of your work you're already in that. And so the new grads that we've hired are typically sponges and just take to the new skill set so quickly. So there's that. New grads do have to be nurtured a lot in terms of like caseload management, and sometimes it's the managing or like relationship management because you're just gathering those experiences, especially when they're a
Mhm.
bit trickier. And so for sure, if you're hiring a new grad or if you are a new grad, just know that there's a bit more support that's required for that.
Yeah.
On the flip side, we've also hired and I've worked with other therapists who have been working in general practice for 10 or 15 or even 20 years, and they've joined our team.
Mhm.
They come with a lot of strengths, of course, with their clinical expertise of the other things that they've learned, and also just life experience and relationship experience of how to work with patients. And so they bring that. But sometimes it's a bit harder, especially if you're established and you have, say, a family and you have other commitments, it's hard to do that extra work that's required for that learning curve because you have an established life with other
Mhm.
demands, which are very valid. And also, like all of us, sometimes we develop, I wouldn't call them bad habits, but you develop habits and you develop like shortcuts in your mind of how to get from here to there, which is really efficient and necessary. But sometimes if you're entering a new area of practice, you really are entering green. You are a beginner in this particular area. And so
Mhm.
there's a bit of, there's definitely a bit of a period of getting used to being a novice again after being so experienced. And so
Mhm.
those people typically require support in different ways.
Mhm. Mhm.
But
Yeah, and
people have been successful in both, and people have struggled in both. So there's no, in my experience, anyways, there's no clear right time to
yeah,
specialize.
there's pros and cons no matter what, it seems like. And yeah, no time is perfect and any time is perfect, really.
Exactly.
So, what are some areas that people can specialize in? What do you see people often asking you about in terms of areas of specialty?
Great question. So I actually made a more detailed post on this on LinkedIn like last week. But when we first think about specializing, we often think about the classic medical system like by body systems. So like cardiologists and endocrinologists and, you know, orthopedic surgeons or those sorts of things. So there's that kind of way. In physio, we're mostly dealing, of course, with musculoskeletal and so or neuro as well. So you could focus in that sense, but there are also so many other ways to specialize. And so I have a list here. Some are by age groups.
Mhm.
So, people working in NICU are with those neonatal infants,
Babies.
pediatrics or uh, geriatrics, for example. You can also focus on demographics,
Mhm.
so men's health, for example, or if you are from a specific ethnicity or a language community, you could say, hey, I'm going to be a physio and I'm only going to offer it in Hindi and really offer it to the Hindi speaking population.
Mhm,
That would be
mhm.
really special and really impactful as well. You can look at conditions like scoliosis, also interest areas. I know Erica Mayall on the North Shore, for example, she focuses on ballet dancers or dancers
Mhm,
in general. And so what a wonderful way using her own background to really impact that population. Also, phases of life like postpartum, for example, or hospice care. Approaches or philosophies. So, this is also becoming more popular trauma informed care. So, it could be how maybe you treat a bunch of different conditions, but the framework and the approach and how the philosophy behind it may be the way that you separate or differentiate yourself
mhm,
from other people.
mhm,
Also, skill sets or certifications, that's another classic way, or treatments. So, in the medical community, for example, psychedelics
mhm.
for trauma is a very specialized practice. And then also delivery modes. Then this has really changed, especially since COVID. But I know, for example, Chipperfield Physio, they are mobile in-home physiotherapy, and Justin has really built a strong business and a strong team around the mode of delivery. And so again, you can also mix and match any of those things. And technically it would be like a hyper specialty. And so even if there are many people, for example, serving a specific community, if you do it in a certain way or in a different skill set or you have a different approach, you can still be hyper specialized and offer something new to that community.
Yeah. Well, and it's interesting. We kind of mentioned earlier before we started recording, like Scoli Clinic, for example, is the intersection of a demographic. So mostly teens. That said, you work with all populations, but it started with teens with a condition using a modality, right? And obviously there's wiggle room within that and things fluctuate and it's not solely Schroth that you use and it's not just teens and there's, expansions within that. But from a high level view, there's an intersection of which modality, which demographic, which condition, and your method of delivery is primarily in person, but I know you also offer telehealth. And so there's so many intersections of niche that people can explore and combine.
In I did some working with entrepreneurs at UBC. I was involved in working with startups a little bit, and one of the biggest messages that the mentors of that program would tell these new ventures or these startup founders is you may want to catch everyone and you think that your solution really is for everyone, but you have to start with a essentially a hyper focus area so that you can test what you do, test your product or your service, refine it, and really get to know that population and the system that, the whole ecosystem around that. And then you can always expand later once you've really like honed in on that. And that's what we did. Pediatric
Mhm,
scoliosis with the Schroth method. And that was really what set us apart. But as you mentioned, we offer so much more now, but
mhm,
we made so many mistakes and so many, evolved so many things because we were just focused on that really narrow focus. And it allowed us to really see what are the trends, like what were outlier things that happen versus like, oh, this population really, everyone faces the same thing. We really need to work that into our model. So I think it's important that if you do want to specialize, although it is true that you could probably help so many people, start somewhere and refine and then
yeah.
expand.
Yeah, I love that. I really like that. I think that's super important because if you think you can get everyone, your messaging isn't going to be clear and people aren't going to resonate with it. Like no one's going to walk through the door unless you have clear messaging and clear targeting for a specific person that you're trying to target.
Exactly. And for you, when your area of focus ended up coming from like a skill set or certification aspect, right?
Yes, yeah. Yeah, exactly. And it was more of a interest in terms of for me, my specialty was in the functional neurology world. I started with neurokinetic therapy and then proprioceptive deep tendon reflex with a, bit of acupuncture put into that. So it became a very unique framework and so I could treat multiple conditions with it, but the specialization very much came from a methodology that I'd kind of put together from different places, but it was all through the lens of the nervous system. And so eventually the messaging was much more like, what's the word I'm looking for? Where it's like more like grooved in, that I was treating the nervous system and I was treating events in the nervous system and reflexes. And so the methodology was very much the approach and the marketing and not the condition, because all conditions could come through. What I was treating was how the nervous system was behaving as a result of XYZ injury, trauma, whatever it was. And so it
And
helped
you
me.
became known for that, right? Like people
Exactly.
started to know, oh, I went to see Danielle for my shoulder. She did this like treatment approach. It totally worked. And then maybe a year later, they have an ankle injury, for
Yeah.
example. And they're like, I know I can go to Danielle because she has this certain way that she does things. And
Mhm.
so I know I've certainly referred people to you because of that, just knowing that you have a certain approach.
Yeah.
And so that's definitely a way that you can be known for what you do as well.
Totally. And I think for me as a new grad, it was really helpful because so you were the one that introduced me to neurokinetic therapy way back in the
Oh,
day. And
yes. I forgot
for
about
me,
that.
it was right.
Yeah.
But for me as a new grad, it wasn't that it was a specialty, it was a framework. I found coming out of school, there was no framework to look at the person. And so, if I can, even just give any sort of thoughts for new grads, finding an area of interest that allows you to give you a framework to look at people might then help guide you too, right? So it wasn't a thing where I was like, oh, I'm treating a condition, but I took an area of interest that was like, oh, a framework, a methodology, a flow chart I can follow when I see a patient. And that helped to find the path for me. So I'm not sure if that's a nice entry or gateway drug for people.
Exactly.
So the other thing I want to flip now is, instead of what are good areas to specialize in, what should I specialize in? What are things that we should avoid specializing in? Or is there anything that is like maybe not the best route to take when it comes to niching, specializing, focusing?
Great question. I wouldn't have a hard answer for what not to do because it has been proven time and time again that when you build something for a very, very specific population and you nail that population's needs and their pain points and you can really solve their problem, there are the most specific products out there. I'm trying to think of one off the top of my head, but I can't. But they're like really specific products or services that inevitably on this earth people need.
Yes.
The bigger questions are going back to what we talked about, that subjective and objective data. I think some, understanding your target market size. What's your
Mhm.
total available market? So number of I did the number of teenagers
Yep.
who are between the ages of 10 and 18 times by 3%. Okay,
Yeah.
that's my total possible market of pediatric scoliosis. But realistically, not all those people are going to come to me.
Mhm.
Some of them live too far. Some of them don't even know they have scoliosis. Some of them won't be able to afford it. So there's like thinking about your total addressable market, but then also thinking about like what's your obtainable market? Who can you realistically reach? And then furthermore, who can you realistically serve? Your serviceable market.
Yes.
Because, say you do have 100 people who want to see you, but you only have 30 hours a week. You
Mhm.
really can only see 30 patients, for example. And so
Yeah.
just kind of thinking about some of those numbers. Also think about things about where, like geography, for example. Being a specialty practice in an urban center really works well for us, being in Vancouver and, being able to catch the surrounding areas. If you lived in a small town, if I lived in my hometown of 10,000 people in rural BC, I don't think I could have dedicated a whole practice, of course. I might have been able to see scoliosis people within another practice and maybe have 50% of my caseload dedicated to it. But just again, how you showed up, what that expression of your expertise would look like will differ
Mhm.
depending on the context and the environment.
Yeah.
Other things to consider are if you, for example, want to focus in a really specific body part, so scoliosis, it's really important to also consider how does that deep knowledge in that one area of the body affect all the other areas of the body. So sometimes a danger of specialization is focusing, for example, if you were only an ankle physio and you only looked at the ankle and someone came in and said, oh, my ankle hurts, but you neglected to look up the chain, which is unlikely. But if you really got tunnel visioned on something, that is a downside of having such a high level of information in one area. And you just have to make sure that you are aware of how all of these pieces fit together for that patient. And so I think it is okay to be, for example, known as a scoliosis person or an ankle person or a shoulder person. There are plenty of people in the community who are known for that. But I can assure you they probably also have a really great understanding of other parts of the body or other things that affect their specialty area.
Totally. And the interplay between all the joints and how the body works
Mhm.
together and how it's all connected. The arm bone is connected to the leg bone
Yeah.
via all the other systems.
Yes.
Awesome. I think this is such a great overview of all the things to consider if you want to specialize, when to specialize, how to specialize, what you can specialize in. And so now let's say someone has decided to specialize, whether they're an independent business within a clinic, whether they've gone online, whether they've opened a specialty clinic. Like we said, there's so many different avenues to take. But now let's talk a bit about the business of being specialized. I know you have, your top 3 things that have affected the way that you've run your business because of being specialized. Let's dive into it. What are the top 3 areas that you help others, especially through your own work that you're doing now? What are the top 3 things to consider in business as a specialist or in a specialty clinic?
Essentially, what I've learned is that every business area needs to be adapted for your unique population and your business needs. And so we can't go into all of those different aspects, but it's literally everything from finance to HR to marketing. But I would say that the 3 major things that I've experienced that I really had to pause and say, "Oh, typical business advice for physios doesn't apply here," or I'd have to take it and tweak it and filter it, or put a different lens on it. The first one for sure is recruitment and training.
Mhm.
So as many of us know, especially if you're a business owner, recruitment is challenging. There are many business physiotherapy clinics or rehab clinics out there. It seems that everybody's hiring. And so that in itself is a challenge. And also because we just don't have as many physios who are available and looking for jobs.
Mhm.
But when you have a specialty practice, not only are you looking for a physio in general who is looking for a job,
Yeah.
you're also looking for a physio who is interested in your specialty area. So for me, it's like, how many physios out there are passionate about scoliosis?
Mhm.
And furthermore, how many of those people, so we've got like the funnel is now quite small,
Yeah.
how many of those people fit our company values and culture and want to work in a team setting?
It
That
sounds like
comes
you're
with,
looking for unicorns almost.
yes. So keep in mind that when you are recruiting, it's a much smaller funnel and it's a much longer runway. So
Mhm.
if you have someone leave your team, you can't just hire a locum to have someone step in within the next 2 weeks. It probably will, like for us, what we've learned is the actual recruitment to hiring is typically, it can be 6 to 8 months to even a year, because it's just depending on the timing and the context of all the things. And so
Mhm.
just understanding that at the get go can help to manage your expectations in terms of how fast you will grow. This really depends as well on the level of popularity of your specialty in the culture or the country that you're in. And so I speak, I'm good friends with Anakin Chadwick of the Triple Pelvis, and I know that
Yeah.
she was on your show
Yeah.
recently.
Yeah.
And we talk so much about how scoliosis currently is about where pelvic health was about like 7 to 10 years ago.
Mhm.
So, as you have probably seen in the news, there's a lot more push for pelvic health. There's a lot of
Yes.
chatter about it. It's not unheard of. Physicians and obstetricians are often referring to pelvic floor physiotherapy. Scoliosis, we're not there yet. And so, just the general level of awareness of what we do and why someone would be interested in working this area is way different than some other professions or some other specializations, for example.
Totally.
So recruitment. In addition to that, there's also training. So again, Anakin and I have chatted so much about how our onboarding process is. We both have very detailed and very unique onboarding processes for our new staff that suit the needs of our clients. But they're very different from each other because we've had to really develop those based on what we've learned. And so again, if you have a specialty practice, a full clinic, you will have to think about what level of standardization do you as the owner want for the service that you're providing into the world? And what's the training that's required? Does it mean that this person has to fly down to the US, for example, and you need to fund that? Does it mean that you can do that in-house? Do they have to take some online courses? And just mapping out what is their entry level of skill that you want? And then furthermore, what sort of mentoring structures and ongoing support for their learning might be required. So really starting to think that through. In addition, and this is not one of my top 3 things, but we'll talk about this. I think if you do want to really create a strong specialized practice that serves its population well, there needs to be some level of standardization of what you do and control over so that it's predictable for the people who refer to you. They know what they're going to get. And therefore, it likely will require you to have your staff on as employees.
Yes.
So just a consideration for, and I know that you have done a lot of work and sharing some information about ICs versus CEs. So that's really important info. The second big area is the difference in marketing and advocacy efforts.
Yeah.
So for many general physio clinics, they're trying to get the word out that they exist. But by the time you found them, it's like most of the time, like, oh, yes, there's this physio clinic that's around. Oh, I didn't know that they were around the corner from me. That's great. I can go to see them. And they're often showing a lot of, either various exercises or clinic culture things, but you kind of know what you're going to get when you go to these clinics. And so their goals for marketing and their brand are very different than a specialty practice. For us, I underestimated how much effort and time, especially in my first 3 years, was going to be required of me to advocate and explain what I do and why it's important.
Yeah.
So many people were skeptical, whether it was physicians who are like, why should we refer to you? Like, what are you going to do for our patients? People with scoliosis just wait and then they have surgery. So why would they do exercise? And so I had to share that there were opportunities to manage it in the preoperative phase.
Right.
Also, even from peers, other physios were like, oh, well, I know 7 other clinics who treat scoliosis. And then I would have to explain, well, how is the Schroth method different? How is our approach different? And so I think, especially if you are a founder who is passionate about your specialty area, keep in mind that it will likely require a fairly significant portion of your time and energy convincing other people why it's important that you exist. And so you do have to have a level of a strong conviction in what you do and belief in what you do, because you will come across a lot of people who don't believe or who are not yet there. And you have to really make sure that you convey that. And so a lot of our early marketing, especially on social media, was around what is it that we do? What is scoliosis? What are the signs of scoliosis? We still do that now, but it certainly in the early days was just trying to justify why we exist. So that's a really big piece of it.
Yeah, you're starting at a bit of a disadvantage in that scenario.
Yes. And so also really thinking through, how do you communicate, especially when you have something so technical like PDTR?
Yes.
How do you take that highly technical thing and explain it at a level that your average audience is going to resonate with? That is extremely difficult, and it takes effort and intentionality around that. So just a heads up.
Yes, that's been a challenge, but that's okay. Everyone else, all the patients have managed to do that for me, and word of mouth is a wonderful thing. And I've been very lucky to experience that.
Yes, exactly. And word of mouth, absolutely. But you also want to to some degree, control what that message is that they're telling each
Yes.
other, right? So if you have a specific thing, for us, it's like we're doing curve specific exercises that are tailored to your
Mhm.
body. That's the message that I would love, if I could control it, that families would share with other families. Like, oh, if you go here, they're going to give you a highly individualized program. They look at your x-ray with you. They make these exercises that are just for your curve. And then you have a home program that you can follow that's just for you. And so, that's, you do want to influence that messaging with
Yeah.
wording that feels good for you too.
Yeah, not just, them saying, "I don't know what she does, but it's
Does, but
magic."
do it. Exactly.
It's
Which is
not
also
helpful.
high praise. High praise.
High praise. We will
High
take it.
praise.
We will take it.
Yes, exactly.
So what is the last piece here? Because I know this one's also a really big one when it comes to business considerations for
Yes.
niching.
So I would say the last and, most, not most important, but one of the big important pieces of owning a specialty practice is understanding what special operational procedures your business requires and getting an appreciation for how much that's going to cost.
Yeah.
So in typical physio business coaching circles, there will be some generic benchmarks of like your cost of goods sold or your wages should be roughly this percent. And you should have, you should spend this much on your rent and it should be this much square footage. So those are really great benchmarks. But I found that when I was comparing, like when I found out what those metrics were, and then I ran those for myself, it was really hard and almost discouraging for me because my numbers were all out of whack.
Mm, mm.
But when I thought about it, I could really justify all of those decisions. And so the most obvious example that I have is that, as I mentioned earlier, when patients come in and if they've had an X-ray, we track that X-ray down in the system.
Yeah.
If that facility is willing to send it to us as a third party, we have all the paperwork to actually acquire a burned X-ray disc, and we
Wow.
have to upload it. And we have a whole system now and a special person who is dedicated to analyzing the X-ray so that it shows up in the clinician's chart, the patient's chart, so that the clinician can look at it. It's already analyzed and use that information in their treatment.
Yeah.
That whole process we have had to refine over the last 10 years because and it's become a significant cost that
Yes.
say a generalized practice wouldn't have. And so we have to work that into our workflow for the front desk, for example,
Yeah.
and also understand that so the therapists understand it and then also work it into our budget. And so often that's part of the reason why a specialized practice may have higher fees than average is because it reflects a lot of these special operational procedures
Yeah.
that may not exist in a typical practice that happen behind the scenes and you may not know of. And
Right.
so really thinking about for whatever niche it is that you want to enter, how does that workflow, if you really want to provide a custom or yeah, a highly impactful service for what that group needs, there are inevitably going to be operational things that have to happen on the back end that you need to really think through, because if you don't, it just, like in the early years, our x-ray process was pretty chaotic because
Mhm.
we hadn't really like focused time on it. And then it got to the point where we were like, okay, enough. We need to write this down, figure out where are the inefficiencies, where are we getting stuck, what can we do about all these things, who's assigned to it. And so really mapping those things out. And that's
Mm.
also what makes a fully dedicated practice so impactful, is because we build the business around the needs of the client and of the team. And so that's the opportunity that you have as a business owner, is because you can be agile and respond to those needs of the team or the client and really design your business practices to maximally impact them.
Yeah, I love that. Well, and the other big one you mentioned there is like budgeting, right? Because if you're doing a lot of training and education, if you do need to send them down to the US to get trained or bring someone in, that's very expensive. So now yeah, like you can't just take a generic like P&L sheet and be able to draft that and transpose it to a specialty clinic. The operations costs, the education costs, like all of these things are going to be so much more expensive because you're delivering a service that is hyper specialized. So there's so many business considerations within all of this, but I think that's a really good eye open, like for me, that's eye opening because I've never had to, think about those things or training other people in a specific modality. But you're right, even something like PDTR, if I wanted to open a functional neurology clinic, I would expect them all to take that training. Now, does that mean, if they're ICs, employees, like, right? Like all of these things are just like dominoes that fall and decisions that you have to
Yes.
make through the lens of that modality or that condition or the service that you're delivering. So I think this is a super awesome overview of lots of the considerations that someone needs to make if they're going to niche down or specialize or open a clinic in a specialty area. So well done. Thank you so much.
Thanks for having me and for letting me share so much of this information. It's definitely something that I've become really passionate about.
Mhm.
Really understanding how you can build a business, or again, if you want to be that researcher or that online guru, or how can you bring your expertise into the world in a way that operationally also makes sense, because passion is great, but it kind of only gets you so far. You also have to have the tactical and logical plans to actually bring it to execution.
Yeah,
So, yeah, thank you for letting me share a lot
absolutely.
of this.
Well, and you're working now with people who are exploring specialty or are specializing. So, how can people reach out, work with you, follow you, and learn more about what you're doing?
Yeah, so I am putting out more content around this and really crystallizing a lot of my thoughts. And I have some different offers that are coming down the pipe. The best place to find me would be on LinkedIn, because I'll be posting a lot of things on there first. And then I hope to, expand that to socials shortly, and have my website live. But for now, LinkedIn would be a great place. Feel free to message me on there. As you mentioned, I just yesterday had a coaching call or a consulting call with someone who was exploring the possibility of specializing. So we did a big brain map and looked at all of the considerations, some of which we talked about today, and gave her a bunch of reflection questions on other data to gather to help her make the decision about specializing.
Mm,
Or I've also worked with people who are already have a specialized practice and they're trying to refine a specific process and figure out how do we work that in. And so, yeah, essentially, I'm happy to work with anyone along that spectrum, on any, whether it's clarifying a process or really just like tackling a specific problem that's happening in regards to running a specialty practice,
yeah,
or being a specialized healthcare practitioner. And it's not
I
just
love
limited to
it.
physios as well. I'm also working with people outside of physiotherapy, which is really exciting.
Totally. Yeah. And like a whole, like specializing and niching exists in so many areas. I mean, it's not just healthcare, it's lots and lots of different businesses. So I'm sure you are bringing value across the board to everyone you work with. So
Oh, thank you.
thank you. As always, Andrea, it's a pleasure. And I can't wait until we do the next one because you are a fan favorite, like I said, and people like listening to having you on the show. I love having you on the show. So the more the merrier.
Thank you.
Awesome. Okay, thanks. We'll chat soon. That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.